In recent years, there's been an accelerated use of digital innovations to improve the quality of perinatal care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. Technology has become a critical aspect of healthcare delivery. Digital solutions have provided avenues for improved access to OBGYNs, doulas, lactation consultants, specialists, and more. Apps for remote patient monitoring or chat and text-based navigation services offer additional ways to support and coordinate care. Joining Priya Bathija, Vice President of AHA Strategic Initiatives, is Trina Jellison, Group Vice President of Women and Children's Institute at Providence St. Joseph Health. Tina will share how Providence St. Joseph Health's use of Wildflower, a digital consumer engagement model, has improved perinatal outcomes. This podcast is part of AHA's 7 in 7 series.
Thank you, Tom. And Trina, thank you so much for speaking with me today. I know you're using Wildflower's technology and services at Providence St. Joseph Health to improve perinatal care. Can you tell us a little bit more about the digital solution you're using and how it's working to address perinatal care?
Sure. One of the things that's really exciting about that, we've branded it Circle for Providence. And part of that is that the mom is typically the CEO of the household when it comes to health. And so, how is she managing multiples of generations herself? We started it with pregnancy and are moving it through the entire lifespan for everybody in the family, basically. And really, the short-term and long-term goal was stickiness to the system through a digital front door. And really proud to say that it's working. It's kind of fun to see all of the different technologies that is available in there. There's trackers, there's birth preferences. And really, the goal was so that the docs or providers, I should say, not just the doctors, but providers would have a more meaningful dialogue instead of regurgitating the same information over and over again with every single patient, but that they could actually assign the patient some learning. So it's a really exciting device that has really, I think, revolutionized, especially during COVID, our ability to communicate with patients quickly.
So is it an app that individuals use on their cell phone?
It's an app and it's a free app. So anybody is welcome to download it, Circle by Providence, if you want to go see it and check it out.
Awesome. And can you share some of the outcomes you're seeing or successes you've had?
Sure. And we actually published a paper about it early on because it was so remarkable to us that something as simple as an app connection could change behavior. With our users, we're seeing an increase in the length of time that they breastfeed, an increase in exercise habits, an increase in or decrease in missing prenatal appointments because there's triggers to remind them of those. And from the provider's perspective, a more robust relationship with the patients. When they're coming in, the patients are asking more intelligent questions. One of the things that I was very proud of is to hear from the anecdotal comments from patients that they stopped looking at Google information and they were looking at the app. And if it was in the app, they stopped there because it was a trusted source of information. For us, one of the goals was in most of the areas that Providence is located, we have all of our babies out to other organizations because we have access to some amazing children's hospitals in almost every single area that we're in. We actually, at the 28-week mark, one of the trackers recommends that they identify a pediatrician for their baby, and it gives suggestions of who those pediatricians might be. And they're staying stuck with our pediatricians. And the way that we measure that is, are they still present at the 13-month visit? And so it's like you see that there's some stickiness to the system.
So this is an app which seems like it's very easy to use. A lot of times individuals may not have access to a smartphone or broadband internet, or they may have, different language barriers. So how have you as Providence taken on sort of digital health equity when you're looking at Circle to make sure that individuals can access this solution if they want to?
Such an important question, especially with everything that we're facing across the nation right now. One of the things that's really amazing, I think, about Circle is everything from imagery to the language that's used is very culturally sensitive and inclusive, whether it be, that you are predominantly Spanish speaking at home. And, it's not just the language has been translated into Spanish, but the functionality, so that it's not just taking English to Spanish. How would a Spanish speaking person approach the app? As far as the cell phone, we really literally have not run into a single person yet that does not have access to a cell phone, which is really a lot of people do not have access to the internet. Using MyChart, which we're an Epic-based company, using MyChart was not an effective means of communicating with people in between visits. Using an app has been an effective means to communicate with people because it seems like most people have access at least to a basic cell phone that they can access a basic app. Quite proud of that, actually, that and imagery being culturally sensitive, but also being aware that it's important to be personalized, because just because you come from some race or some nationality or identify as a gender doesn't necessarily mean that you fit the stereotypical, this is what I want from my birth. The birth preference thing is so important, so that we're making sure that it's individualized down to that individual and taking those culture pieces into consideration.
Trina, I think that is something to be proud of, because individualizing it so that you're actually able to meet a patient where they are is really important, and I think will be even more important as we move into the future. So thank you for being with us today and for sharing more about Circle and Wildflower and how you're using that to improve perinatal care. To all of our listeners, thank you for joining in, and stay tuned for upcoming podcasts in this 7 in 7 series.